It never fails that we take things for granted until we don't have them. And that's true of our knees, because throughout your life, you're going to be putting 80% of your weight on them, and maybe double that when you're running or walking. It helps us to climb, walk, bend, kick, dance, lift stuff, and ride a bike. But imagine if they weren't working. I can tell you from my own life, when I tore a meniscus and I couldn't walk for a while, or from my mom and dad who both had knee replacements, it's no fun at all. So what we wanted to do today is to kind of bring the things you need to think about with your knees to potentially age-proof them and protect them. Knees start out with a fair amount of bone, and on top of that, cartilage, and they're one of your primary joints. Along with your backs, your shoulder, your neck, these are the critical pieces which hit wear and tear every single day. But knee pain is really very common. And in many countries, knee replacements are one of the most common operations performed. It's not inevitable, though, that everyone will need a knee replacement. Some of it is just learning how to live with your knees and know what you need. And so let's talk a little bit about that, and let's get into it. Hey guys, Dr. Nene here. I practice as a cardiothoracic, vascular, and general surgeon, and I'm now a health tech innovator who wants to improve lifespans and lifestyles. So stay healthy, stay curious, and keep watching. So there's a few points which I think are critical for your knees that will keep them going forever. And the idea is to perpetuate those points over a lifetime. The first is to stay active. Exercise is great for your knees as long as you're not overdoing it. Before you start exercising, get to stretching, which helps increase your range of motion. Get into low impact exercises, so you're not banging things up and down. And these include things like walking, swimming, or cycling. I can tell you as a youngster, I played competitive tennis. I also ran cross country and track, and these things really had an impact on my knees. And later on, this became an issue, so I had to calm down. At the gym, if you're doing weightlifting, lunges, and calf work to strengthen your knees and your core muscles, this helps. Within reason, though. You don't want to do a sudden increase in weight and drop it down. You want to slowly come up. This brings us to our second point. Warm up and start slow. Remember to warm up before every activity. The knees are one part of it, but that can include 5 to 6 minutes of walking or a treadmill. It can include anything else, whether you're playing a sport or just helping your family move furniture. Warm up before you start. For any exercise regimen, start low and build on it. Don't try to do max lift or max exercise all at once, and try not to push your body too hard because that results in injuries. Number 3, prevent injuries. We've already talked a little bit about that by avoiding high impact activities like jogging, football, and basketball. Now some of you are going to say, well, doc, that's how I stay in shape, I jog. But honestly, when you have constant pounding motion or sudden erratic movements and collisions, the likelihood of injury is much higher. For me, that was in tennis, where it was not only running, but it was always stop and start and other motions. Pay attention to your form while lifting heavy things. And make sure that you are tracking properly. Have someone watch you, either in the gym or have a trainer do it. Next, if you are having issues, wear a knee brace when recommended by a physical therapist or a sports physician or an orthopedist. Number 4, lose weight. You know, I've said this for your overall health because fat content will cause issues. But if you're overweight, particularly on knees, losing weight will take pressure off your spinal column and your knees and most of your other joints. Not an easy proposition for any of us, but what you'll see is it not only helps you in your heart and your lungs and your abdomen, but it also helps you in your joints, including the knees. In fact, in one study, overweight or obese adults who lost 20% or more of their body weight reported less pain and could walk farther in a 6-minute test compared to those who only lost 5%. So what's clear is if you're obese, moderately obese, or morbidly obese, which is becoming more common, and I've included that in one of our talks on the channel, then your risks of having knee issues long-term and short-term are much higher. Coupled with that, what we're finding now is that fat itself produces and releases chemicals that promote inflammation and could lead to arthritis. It's not a causal relationship by any means, but there is some suggestion of that. Number 5, select the right footwear. Wrong shoes can not only hurt you in the way of your feet hurting and the joints, but it can also affect your knees dramatically. In addition to that, it affects your posture, so all other parts like your back and your neck may actually have an issue with that. For ladies, high heels put a lot of stress. Imagine pounds per square inch in one select zone, but they a lot of issue to your knees or extra stress in that area. Try well-cushioned, low heels and flexible shoes if you can. In addition, wear orthotics or shoe inserts if you don't have normal foot strides. And you can get a podiatrist or a doc or go to a specialized sports store to help you do that. Number 6, improve your posture. Over time, bad posture can lead to issues everywhere. And that includes abnormal stresses on your knees because it moves weight at a different angle, leading to excess stress and wear and tear on your cartilage. Now remember, while bone can rebuild, cartilage can't. And so once you've lost it and you've gone bone on bone on your joints, it's very, very hard to not have pain. And that's when you start needing a medical consult and a surgical consult for potential knee replacement. To date, we don't have great systems to resurface your knees. Maybe in the future we will with stem cells and something like that. But it's not really a potential possibility right now. Number 8, pay attention to what you put in your body. Some foods are pro-inflammatory and can damage your joints. In addition, if you have sicknesses and other things, they can also do it. Now, the problem with this kind of stuff, with processed foods, meats, preserved things, and pro-inflammatory food, is it's not causal in its relationship. They've not taken 100 people and looked at them to determine if it helps. We've also talked about other things which are natural anti-inflammatory agents like pomegranate juice or acai berries or other things. But again, those kind of run into the realm of question mark because we don't know for sure that they really promote it. Does collagen or some of the other supplements help? There's some thought that they might, but again, they need to do more randomized double-blind studies to prove it. There are some other interesting relationships though, like smoking. Almost 2 decades of research has connected smoking with more severe pain and joint disease. And in studies in the past, even in 2022, it suggested that not just smoking, but vaping can lead to that. So it may be an effect of nicotine as well as an effect of the 2,000 chemicals you get from a regular cigarette. So the point is, if you can quit, you will not only help the joints as they are, but if you ever have an operation, your healing will be much better. Finally, when should you visit a doctor when you're having knee issues? And the idea is, a lot of people wait until it's too long. You never want to be miserable. I can tell you with my mom, she would not go to the doctor to get her knees evaluated. Finally, she got her knees evaluated. They said, you're bone on bone. They did 1 knee replacement. And then after that, as stubborn as she is, she still hasn't gotten the second one done because she can do everything she wants to do. And so there's nothing wrong with that. But the point is, there are very elegant, reproducible means to help people now, which are very, very well established and will help you with your life. In conclusion, the knees are one of the critical joints in your body, and you can't do your activities of daily living without them. So it's critical that you care for them as you age, and even as a child, you take some preventative measures. Always teach early and often, because kids never get this kind of education. Prevent injury rather than treating it after the fact, and treat it if you do. Lose weight, select the right footwear, improve your posture, pay attention to what you put in your body, kick smoking if you can. And make sure you go to the doc if it isn't getting better, because over-the-counter remedies don't always work, and you should not have to suffer. Thanks for joining us. As always, if you've liked what we said, hit the like button, subscribe to the channel so you get more pieces which will help you, and hit the bell icon so that they'll alert you when those pieces come up. Finally, don't forget to share, because so many people have issues with their knees, and this is one of those which could help everyone around us. Tell me what you think in the comments below. As always, I've left the links to the data which we put up in the description. And so thank you so much for joining me. I'll see you in the next one.